Today we continue our series on common mistakes dentists make in their marketing. Last Tuesday we talked about dentists who don't do enough to prepare patients to accept large elective cases and who aren't putting themselves in the forefront of the patient's minds when they're ready. Today I want to talk about the corollary to that problem. Stay tuned. Colin here, and welcome back to the Patient Attraction Podcast. Now today, I want to talk about dentists who don't maximize their prospect list. I want to talk about how to build your prospect list more later in the series, but for now, first I just want to talk about your prospects as people who are in need of your services. Now, this could be prospects who have visited your website, and maybe they've looked at specific information on your website, or it could be patients whom you've given a treatment plan to, but they haven't moved forward. All of these prospects should be stored and segmented in a database somewhere. And if you're really old school, it might be an Excel spreadsheet. For our clients, we use Infusionsoft. It takes all of the manual labor out of follow-up. It allows dentists to not only maintain a list of prospects, but know how they're entered into the database and rate them by how likely they are to move forward, to accept treatment. Prospects should buy, die, or cry to get off the list. Now, you've paid for every patient on that list in one way or another, whether it's in marketing dollars for direct mail or your website or an effort to get referrals. And the goal is to get the prospects on the list to get an appointment. Getting someone to set an appointment is the costliest part of your marketing. Maintaining your name in front of those prospects costs very little in comparison. The prospect on the list could take days, weeks, months, or even years to develop, but a warm lead beats a cold lead no matter how long it takes to get to case acceptance. I'll give you another piece of information that has little to do with bringing in more patient dollars, but can still be very lucrative. Now, if you ask any practice management expert out there, they're going to tell you to make decisions with an eye towards one-day selling. You're not going to live forever, and you don't want to die in your office, still drilling and filling. So when the day comes for you to sell your practice, having a big fat patient list of patients who need what you provide is a very strong asset. It could also be a list that you take with you if you sell your practice or plan on starting another practice down the road. Making a mint by building and then selling a practice only to start a new practice not far away is exactly what our client Dr. Raleigh Pioch did. If you're interested in finding out how he grew his practice from $800,000 to $3.4 million in just 5 years in one of the most fiercely competitive areas of the country, grab a free copy of our case study at piochcasestudy.com. Now, Dr. Pioch would tell you that he made plenty of mistakes when he bought his practice, but he's fixed them, and now he has a $200,000 sports car to show for it. Come back tomorrow. I'll address a problem that you might not believe really exists. Until then, keep moving forward.